Thank you for joining us for Restora. This segment is on back therapy. A couple of postures that we're going to do, first by starting out on your belly. So come onto your stomach, palms face down. Bring your chin comfortably onto the floor. This is going to bring a nice extension into the cervical spine, that's the neck. And then as you bring the toes together, the heels can separate slightly. This will bring a nice space into the sacrum. Begin to raise your right leg up. Now, notice that it could be easier for you to externally rotate the leg and drive it up this way, but then you're only really isolating glute medius and glute max. So bring the leg back down. Work on internally rotating the leg. So you're thinking about driving the big toe up and the inner thigh up. So now this is going to incorporate all of these lower back muscles, quadratus lumborum, the erector spinae, multifidus, just to name a few. As well, now you're engaging the glutes and the hamstrings. All of this, these glutes and hamstrings, are such a big player as far as strengthening and conditioning, as well as supporting the lower back. Now begin to exhale, lower, release after a good 5 breaths there. And now repeat on the left side. So inner thigh up, drive the inner thigh to the sky, and breathe for 5, 4, 3, 2. Last breath, lift it up a little bit higher to fill that space you created. Exhale and release. Bring both of the big toes together, and now both legs are going to go up. Inhale, lift both legs. 5. Pick your spot on the floor that you're able to gaze at, so that the mind doesn't wander and say, this is painful, or I want to stop doing this. Instead, if you pick your gaze, if you focus on what you're feeling and drive up into the space that you've created. Every exhalation, drive up a little bit more. Last breath, lift. Exhale, release. Rest your left cheek on the floor here for a moment. Take a deep breath, breathing into the low back. Good. One more deep breath here. And now everything. So we're going to bring the hands up. We're going to lift the hands, the legs, and now the chest. So now not only are we engaging the inner thighs, the glutes, and the low back, but we're also starting to lift the chest. We're adding a little bit more weight to the back to ask the back to lift a little bit more. Now, notice that any time that you're using muscles, you're not just engaging with the muscles, you're also building the bones. So we're pulling on the bones of the spine. We're pulling on the bones of the sacrum. We're even pulling on the bones of the hips and the hamstrings. One more breath, lift. Exhale and release. Rest your right cheek on the floor. Take 2 breaths. Bring a sense of softness now, a sense of relief and release into the low back, into the buttocks, into the hamstrings, the backs of the legs. Great. And then as you place your hands underneath your shoulders, begin to press up, press back. And Katie's going to demonstrate from the side that as you sit back on your heels, sitting on your heels, you're going to take an inhalation. So begin to lift your arms all the way up. You don't necessarily have to, but she's going to, just for the demonstration purposes, she's going to inhale into my hand. And as you exhale, pull the navel back toward the spine and lift the navel up toward the sternum. Inhale, inflate the belly. Exhale, pull the navel back to the spine. This is called Uddiyana Bandha, upward flying lock. Pull the navel up to the spine, up toward the sternum. One more, inhale. We're going to hold it out a little longer this time. Exhale, pull the navel back, pull the navel up toward the sternum. Your diaphragm is attached to the lumbar spine. The diaphragm up here. So when we pull the diaphragm up into the chest, we're also lengthening out these lumbar vertebrae. Inhale, inflate. Exhale, release. These are a few things that you can do to also to strengthen your back. I thank you for joining us, and we look forward to seeing you on your mat. If you live close by, please like us on our homepage and subscribe to our YouTube channel. Namaste.